Next, inflammation of the conjunctiva is called as conjunctivitis. Inflammation of the conjunctiva is called as conjunctivitis. It will, remember guys, all of you or most of you might have suffered from this condition called as conjunctivitis. Yes or no? Yes or no? Yes. Right? Inflammation of the conjunctiva is called as conjunctivitis. Right? So, when you had conjunctivitis, what were your complaint? I used to remember when I had conjunctivitis, my complaint was some foreign body sensation in the eye, some discharge coming through the eye. I was not able to see the lights. I was wearing black glasses. Okay, that is basically photophobia. Right? I was having photophobia. I was having discharge through the eye. I was having what, guys? I was having some congestion in the eye. Red color. My eyes were red in color. Right? So, conjunctivitis. We are talking about what? Conjunctivitis. Conjunctivitis is an inflammation of the conjunctiva. What are the clinical features? The patient will have some congestion which is bright red in color. Normally, the patient will have circumcorneal and circumfornicial congestion. Okay? Circumfornicial congestion. Circumfornicial congestion meaning what? Near the fornix, the patient is having redness. Right. So, guys, we were talking about conjunctivitis. Conjunctivitis is what, guys? Inflammation of the conjunctiva is called as conjunctivitis. We'll start from here, conjunctivitis, okay? So, inflammation of the conjunctiva is called as conjunctivitis. You might have suffered with this infection called as conjunctivitis, okay? Conjunctivitis, inflammation of the bulbar, palpebral or fornicial conjunctiva is called as conjunctivitis. What were the complaints when you had conjunctivitis? What were the complaints seen with the patient, guys, when he had conjunctivitis or when you have conjunctivitis? You were having redness. I used to remember I was having redness. I was having photophobia. I had lacrimation. Right? I had redness, photophobia and lacrimation. Redness is circumfornial congestion. Circumfornicial congestion. Near the fornix, it used to be bright red in color. Right. So, conjunctivitis is inflammation of the conjunctiva which is seen near the fornix. Right. Bright red in color. Slight discharge was also seen. Apart from that, right there, photophobia and lacrimation is also seen. Photophobia and lacrimation is also seen in conjunctivitis. So, remember, when a patient is coming with conjunctivitis, you need to ask the patient to look up and down. While looking up and down, if we find redness near the fornix, then it is case of conjunctivitis. But if you see redness near the cornea, circumcorneal congestion, then it is a case of uveitis. To differentiate uveitis with conjunctivitis, remember, conjunctivitis you will see fornicial congestion, whereas in uveitis you will see circumcorneal congestion. Right? There are some types of conjunctivitis. One is called as true membranous conjunctivitis. True membranous conjunctivitis is seen due to Conibacterium diphtheriae. Then there is pseudomembranous conjunctivitis. Pseudomembranous conjunctivitis is commonly seen due to adenovirus infection, or it might be seen due to other infections such as staphylococcal or streptococcal infection. Staph or streptococcal infection. Next is what, guys? Next conjunctivitis is epidemic keratoconjunctivitis. Epidemic keratoconjunctivitis is again also seen due to adenovirus. This epidemic keratoconjunctivitis is also called as a pink eye or Madras eye. This was commonly seen in that time. Okay? It was commonly seen in Madras. Why? Because the patient, okay, just repeat it. Epidemic keratoconjunctivitis is commonly caused by what organism? Adenovirus. It is also called as a pink eye or the Madras eye. Right? Madras eye. Right? Next is swimming pool conjunctivitis. If the swimming pool is not sterilized properly, then, and if you swim in a water which is not being sterile properly, what will you develop? You will develop chlamydial infection. Chlamydia organism is commonly seen in the swimming pool. So, you will develop what infection? Chlamydial infection. SAT conjunctivitis is called as chlamydial conjunctivitis. So, chlamydial conjunctivitis is commonly caused by chlamydial conjunctivitis is also called as swimming pool conjunctivitis. Remember, guys, adenovirus leads to what all conjunctivitis? pseudomembranous conjunctivitis, it can lead. Okay? Next is epidemic conjunctivitis. Next is chlamydial, the swimming pool conjunctivitis. Swimming pool conjunctivitis is commonly caused by chlamydia, but apart from chlamydia, adenovirus can also cause this swimming pool conjunctivitis. Last is acute hemorrhagic conjunctivitis, where the eye inflames. In normal conjunctivitis, the eye is just inflamed. In acute hemorrhagic, eye is 5 times more inflamed than the normal conjunctivitis, right? So, this acute hemorrhagic conjunctivitis is commonly caused by enterovirus 70. Apart from enterovirus 70, pneumococcal and haemophilus organism can also cause this. Okay? In acute hemorrhagic conjunctivitis, there is dark red spots of blood on the conjunctiva. Dark red spots on the blood on the conjunctiva. So basically remember guys, acute membranous, true membranous conjunctivitis is caused by Corynebacterium diphtheriae. Pseudomembranous is caused by adenovirus. Then there is what guys? Then there is epidemic. Epidemic keratoconjunctivitis is caused by adenovirus, again Madra's eye or pink eye. Chlamydial conjunctivitis, again adenovirus, but the other common organism is what? Chlamydia. Okay? Swimming pool is caused by chlamydia. Last is what? Hemorrhagic, acute hemorrhagic conjunctivitis, which is caused by what organism? Enterovirus 70, pneumococcal or Coxsackie virus, right? So these are the forms of conjunctivitis. That this is acute hemorrhagic conjunctivitis, guys. So what is the best way to prevent this conjunctivitis? Is basically to maintain the hygiene. If you maintain the hygiene, very good. Conjunctivitis can easily be prevented. How will you maintain the hygiene? The basic thing is always have a hand wash. Why? Because hands are the things which the organisms we take from the hand and rub it on the eye, then conjunctivitis can occur. So remember, the best way to prevent conjunctivitis is by frequent hand washing, right? Frequent hand washing. Next is what? Angular conjunctivitis. Last is angular. Angular is seen on the basically conjunctivitis developing on the angles of the eyes, called as angular, which is commonly caused by an organism called as which is commonly caused by an organism called as Moraxilla axenfeld. Moraxilla axenfeld. That is angular conjunctivitis. Okay. So these were the types of conjunctivitis. If the conjunctivitis appears to occur in the infant or the newborn, not infant, in the newborn, then that conjunctivitis is called as Ophthalmia neonatorum. Ophthalmia neonatorum. Neonate is what, guys? Who is said to be a neonate? The child born from the birth till the first month is called as a neonate. When the child is born, he cries, but there won't be any tears rolling out of the eyes. Why? Because remember, when the child is born, he will cry, but there won't be any tears. Why? Because the lacrimal glands are not being formed properly and all, right? Right? There is no tears being formed. If the child cries with tears in the first month, your diagnosis should be what? This child is having conjunctivitis, called as what? Ophthalmia neonatorum. Depending upon when the child is crying with tears, if you see the tearing on the first day of the life, if you see tears coming out on the first day of life while crying, then it is chemical conjunctivitis. Then it is what, guys? Chemical conjunctivitis. If you see tears developing on the second and the third day, then it is due to gonococcal conjunctivitis. Gonococcal conjunctivitis. If you see tears developing on the 5th or 6th day, then it is due to viral infection. It could be herpes viral or any viral infection, right? And if you see tears developing on the 14th day and tears rolling out on the 14th day of the childbirth, then it is due to what? Chlamydial conjunctivitis. So basically what we are discussing, Ophthalmia neonatorum. It is basically conjunctivitis of the neonates. In the first month of the life, the child will cry without tears. If it is with tears, tearing in the first month is due to conjunctivitis. Okay. So we are discussing about what? Ophthalmia neonatorum. It is a condition of the eye in which the first 28 days, Ophthalmia neonatorum, right? Ophthalmia neonatorum means it is a condition where the child cries with tears in the first month of the life. Remember, usually what happens, guys? Usually what happens, until first month there is no tears. Tears are being produced after 4 weeks or first month. If tearing is seen in the first month, then it is a case of conjunctivitis. Tearing on the first day, and if a patient is having tears developing on the first day, it is due to chemical conjunctivitis, right? Where the patient complains of unilateral watery discharge on the eye. Okay? The patient complains is basically tearing on the first day is due to chemical conjunctivitis, where other feature is unilateral watery discharge. Second and third day, it is gonococcal conjunctivitis caused by gonorrhea, gonococcal organism. Fifth, sixth and seventh day, it is due to herpes or other organisms such as staph and strep. Whereas, if the child cries with tears on the 14th day, then it is due to chlamydia. Then it is due to what, guys? Chlamydial organism. Now, guys, coming to this gonococcal conjunctivitis. Here in gonococcal conjunctivitis, the eye becomes fiery red. First of all, why does gonococcal conjunctivitis occur in the neonate? If the mother is suffering with gonococcal infection and the baby is born through the normal vaginal route, the baby picks up the gonococcal infection of the conjunctiva from the mother's birth canal, and the baby will be having eyes shut tightly. The eyes are shut over here, right? So remember, guys, we are discussing about what? Gonococcal conjunctivitis. When does it occur? Gonococcal conjunctivitis usually occurs on the second and third day of the life. This is also called as hyperacute conjunctivitis. The eye becomes fiery red. So just write there, guys. Gonococcal conjunctivitis occurs on the second and third day of life. This gonococcal conjunctivitis is also called as, come on, I have already told you, it is also called as hyperacute conjunctivitis. Right? It's also called as hyperacute conjunctivitis. The child picks up the infection where, guys? The child picks up the infection from the, come on, I told you, from the maternal birth canal. The child picks up the infection from maternal birth canal. The eyes are closely shut. The child is not able to open his eye. The eyes are closely shut. So remember, guys, what is the treatment of choice or drug of choice for this gonococcal conjunctivitis? For gonococcal conjunctivitis, the best treatment is what, guys? It is ceftriaxone. And you can also go for a prevention, guys. If you know that the mother is suffering with gonococcal infection, what you can do is you can go for a Creed's method. Creed's method is nothing but, as soon as the child is born, you take silver nitrate solution and put into the child's eye. That will prevent gonococcal conjunctivitis. But this silver nitrate itself can cause chemical conjunctivitis. So nowadays, instead of silver nitrate, we are using what? Erythromycin drops. We are using erythromycin and tetracycline. So remember, prophylactic method to prevent this gonococcal conjunctivitis, what? Creed's method. We put a drop of silver nitrate as soon as the child is born, but it itself is a chemical that can lead to chemical conjunctivitis. Hence, we are using nowadays what? Erythromycin and tetracycline. Instead of silver nitrate, we are using what, guys? Erythromycin and tetracycline. So remember, that is regarding what? That's regarding ophthalmia neonatorum, right? Ophthalmia neonatorum yani ki conjunctivitis which is occurring in a neonate is called as ophthalmia neonatorum. Will you see tears in the first month of life? No, sir. Tearing in the first month of life is the case of ophthalmia neonatorum or conjunctivitis. We just started with conjunctivitis, guys. True membranous is caused by Conibacterium diphtheriae. Pseudomembranous is caused by adenovirus. Epidemic keratoconjunctivitis is caused by, again, Adenovirus. Okay? Then what is the other conjunctivitis that we have discussed? Right? Epidemic we have discussed. Then we have discussed swimming pool conjunctivitis. Swimming pool conjunctivitis is caused by adenovirus as well as chlamydia. Acute hemorrhagic conjunctivitis is caused by enterovirus 70. Then we came into the ophthalmia neonatorum. Right? Now guys, we are starting with this disease which is called as trachoma. Trachoma. Trachoma is the most common infective cause of blindness in India. Trachoma is the most common infective cause of blindness in India. Trachoma is the most common infective cause of blindness in India. It is commonly seen in unhygienic areas in India. Not only in India, guys. Trachoma is the infective cause of blindness throughout world. Not only in India, it is also the infective cause of blindness in the world. Now guys, remember, trachoma is seen in what? It is seen due to what? It is seen in the persons, or it is seen in the places where the persons live in unhygienic condition. In India, it is commonly seen in Punjab, and the least incidence of trachoma in India is seen in the southern states, again due to hygienic practices and all, right? So trachoma is the most common infective cause of blindness in the world, right? So just right there, most common, no, it's basically the maximum occurrence is seen in Punjab, whereas least is seen in South India. What is the causative organism of trachoma? Trachoma. Causative organism is what, guys? The causative organism is Chlamydia trachomatis. Chlamydia trachomatis. Chlamydia trachomatis. There are many strains of Chlamydia trachomatis, A, B and C, that can cause trachoma, right? There are some strains called as D2K strains which can cause inclusion conjunctivitis. This can cause inclusion conjunctivitis. Then there are, remember, Chlamydia trachomatis is the organism. There are many strains. A, B and C causes trachoma. D2K causes inclusion conjunctivitis. There is a strain of trachoma L1, L2, L3. That strain causes LGV disease. What is LGV? Lymphogranuloma venereum. Lymphogranuloma venereum. So remember, trachoma is commonly, it's the most common infective cause of blindness in the world. Commonly seen in unhygienic or due to the common causes what? Unhygienic or overcrowding right? Trachoma is very, very important, guys. Now guys, what happens in trachoma? First of all, we need to understand Chlamydia trachomatis goes, the organism Chlamydia trachomatis goes in the eye. Our conjunctiva will be ready for it. As Chlamydia trachomatis enters, the conjunctiva will send a soldier against this chlamydia. What is a soldier? It is follicle or papillae? It is follicle. The conjunctiva sends a follicle. So the follicles will try to fight with the chlamydial organism, and you will see this follicles developing on the palpebral part of the conjunctiva. Palpebral means what? When you invert the eyelid, you will see the palpebral form of conjunctiva. That follicles those are developing at the palpebral conjunctiva is called as what? Sago grain follicles. It's called as what, guys? Sago grain follicles. Sago grain follicles, right? Sometimes, just look over here, guys. This I'm talking about. This is the hallmark feature of trachoma. Development of what follicles? Sago grain follicles. Sometimes this sago grain follicles might leave a scar on the palpebral conjunctiva, which is called as what? Arl's line. Which is called as what, guys? Arl's line. Remember, Arl's triangle was different. Arl's triangle was seen in anterior uveitis. This is called as Arl's line. Arl's line is whitish line on the upper eyelid on the palpebral conjunctiva. As the follicles, after the follicles disappear, it leaves a line that is called as Arl's line. We are discussing the classical features of trachoma. You see a follicle. What is that follicle called as? That follicle is sago grain follicle. You will see scarring developing on the conjunctiva, which is called as what, guys? Als line. Als line. Okay? Sometimes you might see some pit-like lesions developing on the limbus. Pit-like lesion developing on the limbus, which is called as Herbit pits. Which are called as what pits, guys? Herbit pits. Right? Herbit pits. Herbit pits. And sometimes after, remember we are discussing the features of trachoma. In trachoma, we'll repeat it once again. In trachoma, the first feature that you see is what? The first feature in trachoma that you see is what, guys? It is the soldiers sent by the conjunctiva to fight against chlamydia. What is that? Follicle. Development of follicles on the palpebral conjunctiva is called as what follicle? Sago grain. Looks like a sabudana. Sago grain follicles. As the sago grain follicles vanishes after some time, it leaves a line on the palpebral conjunctiva which is called as Als line. Apart from that, what else you will see over here? You will see pit-like lesions developing on the limbus, which is called as Herbit pits. Herbit pits. Then you will see encroachment of the blood vessels towards the cornea, which is called as pannus. Which is called as pannus. Apart from these changes occurring over here in the cornea and conjunctiva, eyelids will also get involved. What happens? The eyelashes intern. Interning of the eyelashes is called as trichiasis. Trichiasis. Sometimes the eyelids will intern. Interning of the eyelids is called as entropion. It's called as what? Entropion. You will see entropion. You will see trichiasis. And as the eyelashes are interned, they will constantly rub the cornea, or they will constantly scratch up the cornea, leading to what? Corneal opacity. Corneal opacity. Right? So you might see what? Trichiasis. You might see entropion. You might see corneal opacity. Sometimes you might see thickening of the lid margin, which is called as tylosis. Okay? Or sometimes you might see loss of eyelashes, which is called as madarosis. Okay? So trichiasis could be seen. Right? Trichiasis could be seen. Tylosis could be seen. Madarosis could be seen. Entropion could be seen. Entropion could be seen. Remember, all these features are important. But how will you remember? As there were many features, WHO also gave a classification just to remember those features. What is that classification for trachoma called as? It is called as Fisto classification. What does that Fisto stands for? F stands for follicles. I stands for intense inflammation. Right? I stands for intense inflammation. S stands for scar being developed, which is called as Als line. T stands for trichiasis and O stands for opacity. Right? Fisto classification is what? F-I-S-T-O. F is follicles, I is intense inflammation, S is scar, T is trichiasis, O is opacity. Fisto classification is given for trachoma. Right? Apart from that, you might see some problems with the eyelids. What will happen? If the eyelashes intern, trichiasis. If the eyelids intern, that is called as entropion. Right? Entropion. Sometimes there might be thickening of the eyelids, which is called as tylosis. Sometimes there might be loss of the eyelashes, which is called as madarosis. These all features are seen in what? Trachoma. Fisto classification is very important. Now, if a patient of trachoma comes to you, he'll be having some loss of vision. He'll be having some loss of vision and all, right? He'll be having some discharge. You take the discharge, you keep that discharge under the microscope. What you will see? You will see two things. If it is trachoma, what do you see? You will see HP bodies and Leber cells. What are HP bodies? Halber-Prowazaki bodies, and you will see Leber cells, right? For trachoma, guys, remember. So coming to the microscopic features of trachoma, in microscope, when you keep the discharge, you will see HP, which is Halber-Prowazaki bodies, which are inclusion bodies in the cytoplasm, and Leber cells, right? And Leber cells, right? So Fisto classification and these two cells are very important, guys. How will you manage trachoma? Remember, for managing trachoma, the organism, common causative organism is what, guys? It is chlamydia. For chlamydia, the drug of choice will be azithromycin. You have to go for azithromycin. But if the patient develops trichiasis, Do not just give azithromycin. Trichiasis means corneal opacity can develop, that can cause problems with the vision. So what we can do, if trichiasis is there, then you have to go for surgery. WHO has also given a strategy to prevent and manage trachoma. That strategy is called as SAFE strategy. SAFE strategy. In that, S stands for surgery done for trichiasis. A stands for antibiotic. The antibiotic drug of choice is what? Azithromycin. Azithromycin. If azithromycin is not there, the second line of drug is tetracycline. F is what, guys? Face wash. The patient should be doing face wash regularly. E is what? Environmental sanitation. Environmental sanitation. It's already given over here. S is for surgery. A is for antibiotic. F is for face wash, and E is for environmental sanitation. Environmental sanitation, right? Common complication of trachoma, if you don't manage, then trichiasis can cause corneal opacity. Corneal opacity. That is regarding what, guys? That is regarding trachoma. That is regarding what? Trachoma. The infective cause of blindness in India or the world is trachoma. Caused by what organism? Chlamydia trachomatis. A, B and C. Chlamydia trachomatis organisms. D2K causes inclusion conjunctivitis. L1, L2, L3 causes lymphogranuloma venereum. Whenever chlamydia enters the eye, the thing that is being produced by the conjunctiva is the follicles. Come on, guys. If anyone asks you about trachoma, what do you see? You have to remember Fisto classification, follicle, sago, grain, intense inflammation, scarring, Als triangle, Als line. Next, trichiasis, opacity. Apart from that, Herbert pits could be seen, pannus could be seen, enroachment of the cornea with the blood vessels is called as pannus. All these are the features of what? Trachoma. These are the features of trachoma. Coming to the next disease, which is called as spring catarrh. Spring catarrh. Spring catarrh. Spring catarrh is also called as vernal keratoconjunctivitis. Right. We are discussing about, come on guys, we'll start with this, we'll resume. We are discussing about this condition called as spring catarrh, also called as vernal keratoconjunctivitis. This spring catarrh or vernal keratoconjunctivitis is an allergic infection of the eye. Allergic infection or allergic inflammation, basically. Allergic inflammation of the conjunctiva. Right? It is commonly seen in the spring or the summer, it is commonly seen in the summer seasons and all. Spring catarrh or vernal keratoconjunctivitis. Now guys, what happens as the allergen enters the eye? Again, our conjunctiva comes with two soldiers, follicles and papillae, but it will send only one soldier. Why? Because the allergen is entering. What is that soldier? Papillae. Papillae will be appearing in the spring catarrh or vernal keratoconjunctivitis, right? So, spring catarrh is an allergic keratoconjunctivitis which is commonly seen in the summer. Even though the name is spring, it is commonly occurring in the summer season. It is called, remember, if there a patient is having this spring catarrh, what will be the complaint of the patient? Patient complains of constant itching in the eye. Constant itching, right? With treatment, it will subside. With the treatment, it will subside. But again, it has the possibility to cause recurrent infection, or it has the possibility that it might occur recurrently. So, spring catarrh or vernal keratoconjunctivitis is an allergic conjunctivitis. Whenever any allergen enters the eye, whenever any allergen enters the eye, the conjunctiva that shows a soldier is called as papillae. What is this papillae called as? What is this papillae called as? Now guys, the papillae that appears on the conjunctiva, are called as what, guys? Cobblestone papillae. Once again, the papillae that appears on the conjunctiva, what conjunctiva again? Palpebral. On the palpebral only all these reactions will occur. These are called as cobblestone papillae. These are formed on the upper eyelid and the lower upper eyelid. As the eyelid gets on closing, this papillae gets flattened and looks like a cobblestone. So remember guys, we are discussing about spring catarrh, which is also called as vernal keratoconjunctivitis, which is caused by an allergic reaction. The first reaction that occurs in the eye, the first thing that appears in the eye is what, guys? appearance of the papillae. Conjunctiva throws a soldier which is called as papillae. These papillae are seen on the palpebral conjunctiva, but as they are on the palpebral, they usually get pressed up and they look like a cobblestone appearance. That is a very important feature. Second, as it's an allergen entering the eye, you will see a discharge. What is a discharge? The mucoid discharge, which looks like a rope, that is called as ropey discharge. That is called as ropey discharge. So remember guys, we are discussing about the spring catarrh or allergic keratoconjunctivitis, in which we will see cobblestone papillae, Apart from cobblestone papillae, what else we can see guys? Apart from cobblestone papillae, you will see ropey discharge. You will see what? Ropey discharge. That's a mucoid discharge on the conjunctiva, ropey discharge, right? Apart from that, you might also see some collection of eosinophils on the conjunctiva. Which is called as Horner's Tranta spot. Horner's Tranta's spot. Very, very important guys. Remember, hermit pits were the feature of trachoma. Horner's Tranta spots are the feature of allergic or vernal keratoconjunctivitis, right? And there might be an ulcer developing on the conjunctiva, which is called as shield ulcer. Shield ulcer is absolutely unique. The only place where steroids can be given is shield ulcer. So anyways guys, we are discussing about this vernal keratoconjunctivitis, which is caused by an allergen. Whenever any allergen enters the eye, the conjunctiva is showing us, it throws a soldier. What soldier is it throws? It throws a soldier called as papillae, right? And this papillae appears on the palpebral conjunctiva. That papillae is called as cobblestone papillae, and due to the fight between the papillae and the allergen, there will be a discharge coming out from the eye, which is called as ropey's discharge, right? That mucoid discharge is called as ropey discharge. And you might see, sometimes you might see some whitish spots developing on the conjunctiva, which is called as what spots? Horner's Tranta spots. Horner's Tranta's spots, right? So remember guys, steroids can be given for shield ulcers and all. So other ulcers where steroids can be given are Murran ulcer, interstitial keratitis, and disciform keratitis. We'll discuss that later. Treatment of a person who is suffering with vernal keratoconjunctivitis. What we need to give if a patient is having vernal keratoconjunctivitis? We have to give anti-allergic medications. The treatment is, so whenever a patient is coming with vernal keratoconjunctivitis, what should be the treatment given? The treatment given for vernal keratoconjunctivitis is what? We need to give what to the patient guys? We need to give some mast cell stabilizer, such as sodium chromoglycate, Apart from this mast cell stabilizer, what else we can give to the patient? We can give olapatidine drops. Olapatidine drops can be given to the patient. These are anti-allergic things and all, right? That is regarding what? That's regarding a thing called as spring catarrh or vernal keratoconjunctivitis. Next thing is Pinguecula. What is this Pinguecula guys? Fatty degeneration seen near the limbus. Limbus is what? Junction between the cornea and sclera. The fatty degeneration. You see this fatty spot. Fatty degeneration seen near the limbus is called as Pinguecula. Most commonly it is seen on the nasal side, followed by the temporal side. Again, it's not a problematic thing unless and until that Pinguecula approaches towards the cornea, and normally does not approach. Okay? Fatty degeneration of the conjunctiva is called as Pinguecula. Commonly seen on what side of the conjunctiva? Nasal side, followed by temporal side. Coming to the last thing, which is called as pterygium. Pterygium is what guys? Enroachment of the conjunctiva towards the cornea. Yani कि triangular wing shape What happens in some of the patients who are having dry eyes constantly, they are not at all focusing on their eyes. Basically, they have been diagnosed with dry eyes, they did not take any treatment. What will happen? The conjunctiva becomes dry and it becomes triangular wing shape. This triangular wing shape conjunctiva approaches towards the cornea, leading to a condition called as pterygium. Triangular wing shape invasion of conjunctiva on the cornea is called as pterygium. That is seen due to dry eyes, dry heat, right? Sometimes iron gets deposited in the corneal epithelium. Right here, in this condition called as pterygium, some iron gets deposited over here. That is called as Stalker's line. That is called as Stalker's line. So once again, guys, we are talking about pterygium. What is pterygium? What is pterygium? Pterygium is triangular wing-shaped invasion of the conjunctiva on the cornea. That is called as pterygium. Okay. Thank you.